Sleep Apnea by Chance Shanks
and Alex Heights.
So what is sleep apnea? Sleep apnea is a sleeping disorder when your breathing repeatedly stops and starts throughout the night. Sleep apnea is usually not severe unless not found and treated quickly, and not treated. Sleep apnea causes people to stop breathing in their sleep 5 to 30 times in 1 hour. Sleep apnea can also cause death. Over here is a picture of the airflow of what a sleep apnea machine does, and it opens up the airway.
Symptoms of sleep apnea: excessive daytime sleepiness, loud snoring, episodes of breathing cessations, witnessed by others usually, abrupt awakenings followed by shortness of breath, waking up with a dry mouth or sore throat, morning headaches, difficulty staying asleep, and attention problems.
This is a chart of the adults with sleep apnea symptoms who seek medical attention in 2005 and 2006. Up here on this bar is the total, and it was a little bit less than 30%. Then there was females, which was a little bit under 40%. Males, a little bit over 20%. The people from 20 to 39 years old, a little bit over 20%. 40 to 59 years old, a little bit over 30%. 60 and up had about 25 to 27%. This is a chart saying people after 20, when they were noticed, they went to a sleeping trial and slept, and the doctors surveyed their sleep and got these results, and then people from there on took medical attentions.
When to see a doctor. You should see a doctor if you are snoring loud enough to disturb the people sleeping around you, when you have shortness of breath that awakens you from your sleep, intermittent pauses in your breathing during sleep, and excessive daytime drowsiness, which may cause you to fall asleep while you're working, watching television, or even driving.
So the treatments for sleep apnea, some of them are indirect and you have to completely control them yourself, such as losing weight. No pill is just going to suck all the weight off you. You have to actually work out and lose the weight if you want to be able to breathe better. The fat around the neck could suffocate you at night if you are lying on your back or on your side. Some of the treatments are oral breathing devices that you can wear at night, such as shown in the picture. Medicine that help you stay awake during the day. Surgery
To remove the tonsils,
to remove the tonsils.
which is also called a tonsillectomy. How does sleep apnea occur? Sleep apnea occurs when the muscles in the throat used for talking, breathing, and swallowing are relaxed and can stretch. When this happens, carbon dioxide gets trapped in while oxygen is kept out. When this happens, usually the person abruptly wakes up and takes many deep breaths.
So why people with apnea don't get help is usually they don't even know that they have it, because what happens is when they wake up in the middle of the night, they go right back to sleep after a few deep breaths because they restore the oxygen that they lost. So they wake up, take a bunch of deep breaths quickly, and then go back to sleep. And that study that was on the chart a couple slides ago was a chart from 2006 to 2007. And when the doctors observed people sleep, they surveyed them in the morning and asked them if they remember waking up, and the majority said they did not recall.
Other names for sleep apnea: central sleep apnea, obstructive sleep apnea, and sleep disordered breathing.
Right here is the obstructive sleep apnea, is when your tonsils become too big, and usually this is when they surgically have to be removed. Central sleep apnea this is a little bit more severe, such as the symptoms: heart failure, breathing issues, multiple sclerosis, stroke, brain infection, tumor, or
Hyperxemia of high altitude.
And then the range of sleeping disordered breathing is just from as low as snoring to the obstructive sleep apnea, which is if you're snoring, you obviously don't have a disease, but once you get past a certain point, it's considered a disease. These are citations. Another picture of normal breathing to abnormal breathing of blocked airways, and that's the end. Thanks for watching.